Great article today in The Guardian titled, "What about the other 35 million people who are still uninsured?" Now, they're talking, of course, about the healthcare situation in America with the recent Affordable Care Act Supreme Court decision, where this is the second time that they upheld it in parts. There was one decision a while back where they struck down parts of the law, but since then there's been two decisions where they upheld it. So we spoke about that decision. We think they made the right decision. We were praising the decision. But this guy raises a good point, and this is something that we briefly mentioned when we had the conversation the other day. What about the other 35 million people? What about the fact that we still don't really have a universal healthcare system? Now, understand, when I mention this, people who are loyal defenders of Obama don't get too defensive here, because I'm not taking away credit from Obama for what he did. As I've said time and time again, Obamacare, the Affordable Care Act, was a significant step in the right direction. There are many great provisions of that law. But the fact remains, and even he admits this, the fact remains that the issue is you have the root of the problem is still there. Namely, for-profit health insurance companies, and I would even go a step further and say for-profit health care companies. So what are we going to do, man? I mean, we can't just declare victory when the system is still fucked up and say, well, it's good enough. Maybe good enough for you if you happen to be covered because you make an okay amount of money, but not so good for the people who are still uninsured, and not so good especially for the people in red states who didn't get the Medicaid expansion because the governors refused to sign on. It's not a sufficient answer for them. So what I would say in response to this article, but also in response to, people who don't know what direction to go in from here, what I would say is full court press, son. Now, I know the composition of Congress is different now. I know it's going to be harder to get anything done now in terms of substantive policy right now. But yeah, you got to understand, that's the whole point of politics. So it's one thing, we could have a policy conversation, which we always like to have on the show. We talk about policy and what's best and why. But playing politics is a whole other aspect to politics in America. It's weird to say playing politics is a part of politics. Duh. But it is. There's a difference between policy and politics. And oftentimes Democrats are better on policy, terrible at the politics. Whereas Republicans are the opposite. They are great at the politics, terrible on the policy. So when I say full court press, what do I mean? Well, use this issue to destroy in the next election. You say exactly what I was just saying. Obamacare is a giant step in the right direction because of reasons A, B, and C. We covered millions more people, no more pre-existing conditions, yada, yada, yada. But then you get to, the work isn't done. And 17,000 Americans are still dying because Republican governors refuse to expand Medicaid by just signing their signature on a sheet of paper. Say it over and over and over. Republicans are condemning 17,000 people to die because it's true, it's factual. Harvard study found that. So what do? You fucking shame them. You shame them into either accepting the Medicaid expansion or you shame them to a crushing election victory, and then after you win the election, boot to the neck and you get through a public option, and then eventually you get through single payer. Look, I understand, man. Sometimes criticism we often get of this show is so easy to just say we should do A, B, and C, and then the conversation's over. But you don't understand there's a lot of hard work involved in getting A, B, and C. You can't just say we need A, B, and C and end the conversation. And they're right about that. That's a legitimate criticism. But which is why I'm telling you, okay, I understand that even if you do fast change, sometimes fast change includes incremental aspects. Well, what I'm saying is let's continue with the incremental aspects ASAP. Step number 1 is shaming the fuck out of the Republicans for continuing to block progress. Step number 2 is you go towards a public option, not just an individual mandate system, which we have right now. Step number 3 is single payer. You bring in the top experts from around the world who crafted other single payer systems in other modern nations. You work with them. You figure out the best way to get it done here. You kick the lobbyists out of the fucking conversation. You get the job done so we can join the rest of the modern world with having universal health care. Right now, we could celebrate that Obamacare is back in place and staying there, but that celebration should be brief because it's cold comfort for 35 million people who are still uninsured, and it appears as if there's no light at the end of the tunnel. Being on the right side of history and being a liberal means you have to fight to get that light at the end of the tunnel, and you need to help these people, and we need to make sure we run across that goal line.